In this lecture, we will review physical development in infants and toddlers. First, let us ask the question, what are developmental milestones? Well, according to clevelandclinic.org, developmental milestones are the behaviors that mark stages of typical growth. Children all develop at their own pace. However, most children pass through specific changes at approximately the same time as they get older. Examples of developmental milestones in a baby's first year of life may include smiling intentionally, sitting without support, waving goodbye, moving objects from one hand to the other, transitioning from crawling to taking steps. As they grow older, a child's developmental milestones may include knowing names of people or body parts, using sentences with 2 or 4 words, sorting shapes and colors, repeating familiar songs or poems from memory, and telling stories. According to Grabber in 2021, physical growth refers to an increase in body size, length or height, and weight, and in the size of their organs. From birth to about age 1 or 2 years old, children grow rapidly. After this rapid infant and early toddler growth slows until the adolescent growth spurt, which we will get to in my upcoming lectures. As growth slows, children need fewer calories, and parents may notice a decrease in appetite. 2-year-old children can have very erratic eating habits that sometimes make parents anxious. Some children may seem to eat virtually nothing, yet continue to grow and thrive. Actually, they usually eat little one day and then make it up by the next day or two by eating more. During the preschool and school years, growth in height and weight is steady. Children tend to grow a similar amount each year until the next major growth spurt occurs in early adolescence. Different organs grow at different rates. For example, the reproductive system has a brief growth spurt just after birth, then changes very little until just before sexual maturation or puberty. In contrast, the brain grows almost exclusively during the early years of life. The kidneys function at the adult level by the end of the first year. Children who are beginning to walk have an enduring physique with the belly sticking forward and the back curved. They may also appear to be quite quote-unquote bow-legged. By 3 years of age, muscle tone increases and the proportion of body fat decreases, so the body begins to look leaner and more muscular. Most children are physically able to control their bowels and bladder at the same time. Doctors report how children are growing in relation to other children their age and monitor the children's weight gain compared to their height. From birth until about 2 years of age, doctors record all growth parameters in a chart by using standard growth charts. After 2 years of age, doctors record growth parameters by using growth charts from the Centers of Disease Control and Prevention, otherwise known as the CDC. Now, length is measured in infants. Height is measured in children who can stand. Infants are placed on their back on a suitable device, such as a measuring table, and children who can stand are measured using a vertical or stand-in device. Now, In general, length in full-term infants increase about 30% by age 5 months and more than 50% by age 12 months. Infants typically grow about 10 inches, which is about 25 centimeters during the first year, and height at 5 years is about double the birth length. In an article by clevelandclinic.org, what are the signs of developmental delays? Signs of developmental delays can vary significantly. Sometimes you may notice signs of a delay during infancy, or symptoms may not show up until a child is school age. Some of the most common signs of developmental delays can include rolling over, crawling, or walking much later than expected, difficulty communicating, talking, or fitting in socially, problems with connecting actions to consequences, inability to perform everyday tasks without help, such as getting dressed or using the bathroom, trouble remembering instructions, learning challenges in school. Now, what causes developmental delays? Well, some developmental delays have no known cause. Some delays occur due to genetic factors, such as Down syndrome, Fragile X syndrome, or Angelman syndrome. Some children have a higher risk of developmental delays due to environmental factors such as exposure to toxins before birth, such as alcohol or lead poisoning while in utero, low birth weight, preterm birth, severe trauma such as abuse. And I will go over the different types of child maltreatment in an upcoming lecture. So, what should one do if they notice that their child have signs of developmental delay? Well, if you notice signs of developmental delays, speak with your child's pediatrician. The pediatrician may recommend a developmental evaluation. This evaluation can involve specialists such as a child psychologist, a developmental pediatrician, and that is a doctor who specializes in child development, neurologists, occupational therapists, speech language pathologists, and physical therapists. An evaluation may include observed playtime, structured tests, and parent questionnaires. The results can determine if your child would benefit from special interventions or therapies. So, what are the treatment options for developmental delays? Well, first of all, we need to know that developmental delays do not have a cure. There are no cure. However, certain types of therapy can help with functions as well as keeping up with peers. Some therapy includes behavioral therapy for children who have trouble behaving appropriately at home or in school settings, occupational therapy to work on fine motor skills and completing everyday tasks without help, special education for support with learning disabilities and social skills, speech and language therapy to address difficulties with creating or understanding speech and language sounds, physical therapy to address delays in gross motor skills, such as physical changes that affect how a child walks. Now, why are developmental screenings important? Well, in the USA, about 1 in 6 children have a developmental delay. When healthcare providers find a developmental delay early, they can offer interventions. These interventions help your child succeed in school, connect socially, and learn to communicate. Now, this is a note from Cleveland Clinic. Child development refers to all the milestones that experts expect children to meet by certain ages. These milestones include how children grow physically and develop socially, emotionally, and mentally. If children don't meet these expected milestones, a healthcare provider can evaluate them for developmental delays. While there is no cure for such delays, certain types of therapy can help the child to thrive.